Hello, hello. Welcome back, everybody. Welcome back to the podcast. So glad to be back recording episodes with you guys. So I have some updates and some really good information to give you guys because I have a slew of brand new episodes for the month of October. Okay. So I am bringing you some really good impactful information on this podcast. And if you haven't, subscribe to the YouTube channel because there's more content coming to the YouTube channel as well. So let me kind of run through some updates really quick, okay? So like I mentioned with the YouTube channel, I am going to be posting here soon, probably this week. So make sure you follow on social, make sure you're on my email list so you can get the exact date on when I'm dropping this course. I am going to be teaching and uploading a video on a patient centering course because that seems to be a topic that's really, really hot is patient centering. So I'm going to give you some really good tips and I'm going to go into depth on patient centering and why that matters. Okay. So make sure you stay tuned for that. That's going to be uploaded on the YouTube channel later on this week. So make sure you're on the email list. Make sure you follow on TikTok and Instagram because I will be releasing the date on that. Okay. Also, make sure you guys follow on TikTok because I drop some really good informational stuff when it comes to CT on TikTok because that is my main platform. That's the platform I love to post on. So make sure you do that as well. Now, I've also had a backup page on TikTok. That's when my main page did get hacked, but it was restored to me a few months ago. So I have just kind of kept that second page dormant. Well, I've decided to rebrand it and I'm going to be talking about more life content, sharing more pieces about my life as a mom, being divorced, relationships, doing healing, inner work, and just childhood, inner shit trauma. If you want to follow that page and see all the good stuff on that, I'll have a link in the show notes so you can follow that page on TikTok. Okay. That one also has its own dedicated podcast and YouTube channel. So I'll put all that stuff in the show notes so you guys can follow along. So got some really good episodes coming for the CAT Scan Guru podcast. Just some things that we're going to talk about and we're going to dial this shit up a little bit. Okay. So in today's episode, we're going to talk into depth about CT 101, what you weren't taught. Okay. I know I've gone through CT 101 episodes before, but this is going to be spicier with some hotter takes and some information that you really should know. So if you're new here, make sure you subscribe to the podcast and make sure you like, share, with a technologist that fucking needs to hear this shit. Okay. So real CT training didn't come from a program or from your first job. I know that's going to be a hot take for everybody. This is the episode that's going to give you some foundation so you can stop guessing when you're doing your CT training, especially as a new technologist or if you're at a new facility, right? So let's be real, okay? Let's have a reality check for a second. Your program, in CT or the minimal training that you received when you were just starting out, taught you just enough. It didn't teach you everything, but it taught you just enough. But that enough wasn't good enough. Okay. Now, I'm going to be talking about some things here on what I think you should understand and what are the foundations of CT. Okay. Now, not knowing your anatomy, your protocols, contrast timing, all those things are very important. Okay. Because there are certain landmarks, there are certain anatomy that we have to cover depending on the exam that we're scanning, depending on the scan that is asked for. And sometimes patients are very complicated and you can't get like an optimal scan and you have to do the best that you can. Knowing your basic protocols. Listen, in CT, there's a shit ton of protocols, okay? The protocol book is thicker than I don't know what. It is physically impossible for you to remember all those protocols in your freaking brain. Okay, that's why I encourage techs to make sure that they take a notebook or something with them so they can write shit down. So protocols, there are, basic protocols that you should know. Your head without contrast, your PE study, your abdomen and pelvis with contrast, your C-spine, facial bones, things that you do every day, all day that gets ordered through the ER consistently and that we're freaking bored of scanning. Those are the things you need to know. Contrast time, because certain exams have different contrast timing. So For example, a PE study has a different contrast timing than an abdomen and pelvis with contrast if you're looking for abdominal pain. The timing is very different, and those are the things that you need to know. Now, this is one of the pieces that I stress in every podcast episode, and I am going to continue to tell you until I'm blue in the face, until you get it. Patient positioning. Why this is the foundation of it all. Because optimal scans and optimal dose start out with correct patient positioning and centering. Let me say that again. Optimal exams and optimal scanning start from proper patient positioning and centering. It's the foundation of everything. That's how you get your dose, under the limits that you're supposed to, making sure you're administering the correct dose. Because you need to remember, your Scout calculates how much dose is going to be delivered to the patient, and the system calculates that. So if you're way off, it's going to calculate either something that's way too low and the tube is starving, or it's way too high where it's exposing the patient with too much radiation. Now, I know there are certain instances where you get contracted patients, patients who are combative, patients who are just a hot mess. What I say to that is to do the best you can. You could still position and center properly, even if they're contracted, even if they're a hot mess. You can still do it right, okay? And then your landmarks that matter, okay? So we know for a CT of the head, you're going to center at your OM. You know for your chest, you're going to center at the sternal notch. You know for the abdomen and pelvis, you're going to center for the xiphoid tip. Now, with systems like Siemens and Philips, you have to center higher. And this is one of the things that I taught one of the techs that is brand new to our department where I work at, is on the Philips machine that we have in the department, you actually have to center higher because the table starts moving before the tube exposes. So, and I said, just watch it when it gives you the green light to go, just watch the table and listen to the exposure. And sure enough, the table started moving first before the exposure hit. So that's why you have to center higher, okay? And then mastering your protocols. Now, I don't expect you to know every single freaking protocol there is to man, okay? I expect you to know the basic ones because those are the ones that you're going to, get repetition on, you're going to be consistent on, and you're going to build knowledge on. Because once you are consistent, there's repetition, and you have knowledge on all the basic protocols, you're going to fucking just kill it with the other ones. And you're going to know exactly what to do, and you know what you're doing. Okay, so you have to master those protocols. Plus, you also need to master on what you're doing in that room with the patient. It's not all about pressing buttons, guys, because you know what? I get some text in my comments on TikTok that they feel that it's just pressing a button. I'm telling you, CT is more complex than that, and radiology is more than that, okay, than pressing a damn button. It's not all about pressing buttons. You're actually making an impact in that patient's life and trying to figure out clinically what is wrong with them so doctors can treat them, okay? Now, you can't be confident if you don't know the basics, period, end of story, okay? Like you need to know your basics. You need to know how to position your patient properly. You need to know how to utilize the buttons, how to put them on the table correctly, how to, maneuver the table up and down, where to select the protocols, on your screen, how to execute that contrast timing, making sure your IVs are good and they're checked properly, making sure that your contrast injector is primed and ready to go, making sure you're checking labs, checking the orders, checking the chart for allergies and all that stuff. So you have to know the basics. And that's why I give you an 8-week checklist, which you can find in the show notes, on things that I feel that you should know when you're starting out in CT for the very first time. And especially if you're a new technologist, you really need a guide to know how to execute those things, okay? Now, it's not your fault that you weren't taught correctly, okay? But it is your fault if you choose to stay stuck there and not do anything about it. I can't tell you how many times I have worked at different institutions where techs fail to improve, their scanning abilities, to learn the new trends, learn the latest and greatest, to get more education, to go to the seminars, to learn something because they say, oh, well, this is the way it's done. This is how we're going to do it. And I don't need to know anything else. No, our technology is constantly evolving. It is constantly changing and things change, especially with, faster scanners, different kinds of protocols being added, new things being added, things that are getting taken away from X-ray and coming to CT. Okay, when was the last time you saw an IVP done? Okay, the last time I saw an IVP done was probably 20 plus years ago when I was working in X-ray. Okay, I've been in tech for 23 years. So it was probably about 20 years ago. CT has taken that on. We do urograms, we do cystograms. So we have taken that on. When is the last time you saw a mandible in X-ray done? Now, I'm not saying that they aren't done, but how often are they done? You know why? Because CT has taken that over. So it's really important to invest in your continuing education, in your knowledge, and staying up to date with the latest trends. I can't tell you how many technologists I've met over my entire career that choose to stay stuck. And then they wonder why they can't advance into anything, because you're not willing to put yourself out there, invest in yourself to learn something. And you really should. Okay, that is the name of the game. Like, if you want to stay stuck, that is a personal choice. But I know there's a lot of room for growth and for improvement and to move on, to excel into things that you have a passion for or things that might light you up. Okay. What lights me up is doing this podcast. What lights me up is teaching. What lights me up is going on TikTok and giving you that educational information that you need to know, because it actually helps people. Can't tell you how many times in my DMs and in my comments about people who appreciate and praise that I give out this information because it's so helpful. So think about it like that, okay? It is your fault if you choose to stay stuck and not, leave room for growth, okay? It's not your fault that you weren't taught correctly, because there are techs that are training the newer ones coming in, and the training is shit. And I hate to say that, but that's the truth. So we're going to be honest on this podcast. And there is room for improvement on that. And us as a community need to just, get involved and improve the situation. Okay. Because that's what it takes to make this community just wonderful. And there's a lot of room for growth and just elevate things so that we are seen. Okay. So those are my talking points for this podcast episode. Like I said, everything that I discussed, and as far as where to find things, everything will be in the show notes. As far as any courses that I hold, that I offer, that I sell, sorry. Where you can follow me on social media, TikTok. Make sure you subscribe to the YouTube channel. My 8-week checklist that is there for you, and it's available free, so you can get on my email list and you will know exactly when I drop podcast episodes, when I drop YouTube videos, and when I drop the latest TikTok videos that are important, right? So make sure that you guys check out the show notes and make sure you follow me on social, subscribe to this podcast, share this episode with somebody that needs to hear it, because a lot of people need to hear it. Okay. So thank you so much for joining me in this episode, and I will chat with you guys next week.